It's crazy.
You're live.
Hey guys, it's Dr. Emer, and we had a big following on social media yesterday for our patient that had lost a lot of weight. A lot of you guys wrote in saying that you lost that much weight too, and you were going through a big body transformation, and you really wanted this type of surgery, and were wondering what it entailed. So he had what we call a circumferential body lift, where we make an incision all the way around and take a donut of skin out. Also do some contouring, and then the biggest thing that I saw, if you look at the angle of his nipple here, it's angled downward because there was some indentation here. I can show you on the side from a previous gynecomastia surgery. You see that little indentation right there. If we look now, show the chest. We literally did some fat grafting, and we lifted the chest doing a chest lift around the nipple. And we call this a nipple lift. Some people call this an areolar mastopexy. It was typically traditionally not done on males for a very long time period, but we've started to make it become more commonplace to give a more athletic look. You could see the lifting in his chest here and making more of this border, which will become more apparent. And you see right here where there was that indent, you see right there, indent right here, now take a look, is gone. And that's because we did the lifting and we did the contouring there. The biggest thing also is he doesn't look big, but his skin was very movable. It's because you could see the stretch marks that were there because he lost a ton of weight, which is great, and he's obviously super athletic. But now if you take a look at his stomach, much flatter, especially along the sides. If I were to pinch here, there's literally no skin here anymore. This is just swelling. You could see his lat muscles. You could see the border of his chest. So our goal was to just get him to be super tight. So if we take a look and we zoom in here on the stomach, and you guys see that stomach there with the looseness, and we now look at his stomach, it's flatter. I'll switch with you. It's flatter. It's tighter. Can you squeeze as hard as you can? Even here, you can now see the ribs. You can see some muscles starting to define. We did the Renuvion plasma all throughout here to get some tightening, and we did our tuck and our circumferential lift. You could see the incisions being very small, and a lot of questions about the tattooing and how it was going to affect his tattoos. We already knew it would, but he's already got a plan to redo the tattoos. So everyone was so concerned about the tattoos more than they were him, which I couldn't believe. But that's okay because he already has a plan with his tattoo artist on what to do. So the goal is to get him as tight as possible, and you can see now that looseness, that hanging is gone. If you look at our Snapchat, it shows a video of him bending forward and how much looseness in his skin he has. Now, if you pinch, Mike, can you pinch just a little bit? Look, you can barely move the skin, which is the goal. We want it to tighten up, we want it to contour, and that's what's gonna happen. He's gonna be more defined along the sides, the midline, and through this upper part of the chest, and then the goal will be long-term, he just has tightening. So what are they saying on that?
They want to know, can you walk after the body lift?
Did you walk today? How did it feel?
I walked last night.
You walked last night? No problems. I will tell you, the Renuvion plasma really helps coagulate underneath the skin, so there's much less bruising. You can take a look, like almost no minimal bruising, only a little through the armpit area, and less swelling when done properly. Obviously, he has drains in there. You could see the blood coming out of the drains. That's normal after doing what we call a body lift. But you know, when you lose 100-something pounds, this is what you have to do, unfortunately, sometimes. And to be honest, it's going to be life-changing. It's going to be the best thing you ever did. What else?
They're saying amazing work. We love his results already.
Well, we'll follow him over the next couple weeks. And I just want you guys to see one more time. Here you could see a lot of the looseness, and here you could see a lot of the looseness. And now if you take a look, it's tighter, and along the sides, there's literally no, take a look at that, it's gone. You see what I mean? Look at the bump there, look at the bump there, it's gone. So it's an amazing outcome. He's feeling great. We just got to watch him over the next few weeks and make sure he heals properly. We're doing our Aftercare lymphatic massage, which Michael's doing right now. You could see really pushing the fluid, toxins, oil, gas from the helium plasma out of the tissue. And then also IV therapy. So he's a big muscular guy. He doesn't feel dehydrated and faint over the next couple of days because you lose a lot of fluid, a lot of mass after the liposuction. And then that's it, and compression. And we're really he's going to do hyperbaric oxygen therapy to help his wounds heal faster too. So have a great day, guys. Day 1 post circumferential gladiator body lift.